Judy, thanks for visiting with us. It's good to see you had a fabulous career in ECHO, but I wanted to ask you, how did you get introduced to ECHO in the first place?
Well, sure. Thanks, Randy, for having me on and doing this interview. So ECHO started for me in a dark reading room with Bob Levine when I was doing my rotation as a cardiology fellow, and there was just such enthusiasm that was present in the physiology and the mechanisms that were available. It just really got me excited.
That's interesting. So then how did your career progress, and not only what you did, but as you saw technologic advancements, and how were you involved in those?
Well, sure. I mean, first of all, I'd have to say that I am so lucky to have trained in the MGH Echo Lab, because the mentorship and the research and clinical experience there was just amazing, and that really was the key to my career. So I think in terms of, there was so much research looking at physiology and mechanism, and I just loved it. So my research mentor was Bob Levine, and so we got into the physiology of valve disease, especially mitral valve disease, and kind of just started all from there.
And so what happened after your fellowship? Tell me a little bit about your career after that.
Yeah, so after my fellowship, I was signed on as faculty staff at MGH Division of Cardiology, primarily working in the Echo Lab. And again, that was such an important opportunity for me because it allowed, there was so much mentorship. Ned was there, Mike Picard, Bob, Marietta King. They were so nurturing for junior faculty, and really allowed me to develop my research, my interest in physiology and valvular physiology. And they really created the environment and the excitement to make that happen.
No, and you're right. It's a stellar group, and it has been and always will be a stellar place for advancing echo, quality echo, and all of that. How did you first get involved with the American Society of Echo?
Well, again, it was through this, through the MGH Echo Lab. Obviously, Ned Wayman was one of the early presidents, and clearly a leader in echocardiography. And everyone was encouraged to be part of the society. And as I said, it's been my professional home, really.
And so how did it begin? Besides being encouraged, and then how did it?
Well, the encouragement started with, let's do this research project, and submitting submitting it to ASE as an abstract, and then going there, presenting it, meeting people. Getting feedback, the scientific back and forth, and it was just an amazing time. I really had a wonderful time, and the ASE has always been the best scientific meetings for me.
And you basically worked your way up through the committees and things. You put time in with the society. That's what's important.
Oh, sure.
But it was time that you got a lot of rewards back, and
absolutely,
interpersonal rewards. But so you became increasingly involved with the ASE.
Right. So the first step was the abstracts and going to the scientific sessions, meeting people, getting them to know them, and them knowing you. Right. And then from there, it was being involved in volunteer opportunities, whether it's committee assignments or speaking engagements, and it just sort of built from there.
So you were the 31st president of the American Society of Echo, and you survived the year of COVID.
Yes, I refer to myself as the COVID president.
Covert or COVID?
Maybe both,
But tell me a little, because I want to know a little bit of your thoughts about your presidency. I could say, what were the major issues? And that sounds like a pretty major issue. But what were the major issues that went on?
Oh, sure. I have to say, because I get asked this question a fair amount, It was actually quite a rewarding time to be president because it really highlighted the strengths of this organization and its members. It just made the entire organization shine. And I'll tell you how. Obviously, March 2020 is when the pandemic kind of hit the U.S. And so you can imagine the adaptation and pivoting that had to be done by the society. Within, really 3 months, 4 months, we had to change completely the way we did our educational conferences, our research, and we did a great job. The staff was phenomenal in being able to adapt and innovate. That's what I mean, and just figure out, okay, we got to do it this way, and we did it successfully. And I also have to, I'm very proud of also the membership who adapted to that, the new way of doing education, new way of being involved. And they were very dedicated. We had one of our best years in terms of participation.
Interesting.
And during the COVID year.
Interesting. You also were, and I'm not taking away from that because that was, and you're right that was a really critical time for the society, and it's shown. I mean, it really because of people being engaged, and it was very reassuring, I think, for people to have those contacts, even especially digitally. But you developed the 5 specialty interest groups, the SIGs, as they're called. Tell me a little bit about that.
Yeah. So first of all, I didn't develop them. They kind of happened on my watch.
I'll give you credit.
All right. But the idea was really to be more inclusive in society as, greater non-traditional users of ultrasound adopt this wonderful technology, and to sort of engage in these interest groups. One of the first ones that actually became a council was the critical care echocardiography, because a lot of critical care, it's a wonderful tool. And this ASE was a professional organization that they could grow and develop in.
And I think it was good that you had things like the interventional group coming along
As well, and in emerging enthusiasts also became a SIG as well.
Yeah. So and that, I think the key thing is not only were they involved with under the ASE umbrella, but they also, as you said, it was sort of the inclusion, and increased membership, and increase the community. And we could learn. I mean, there's a lot to learn from the critical care physicians, and a lot, obviously, the interventional stuff is
Absolutely.
taken off like crazy.
Yeah.
You also were pretty active in expanding partnership with industry. Tell me a little bit about that.
Well, I think that's an obvious area that ASE should partner with. I think increasingly, increasing industry is a leader in innovation, and they're an important partner for cardiovascular ultrasound. One of the areas that we expanded in was that I think traditionally we have our industry partners were understandably ultrasound companies and ultrasound vendors, but as it was increasingly recognized that echo is a fantastic diagnostic modality for disease states. We also began to partner with pharmaceutical companies as well as valve device companies,
Right.
as we sort of expand and people increasingly recognize the value of echo.
Yeah, the diagnostic and management capabilities of the technology are the things that just blew me away in its infancy, and still does. And I think, I talked to Jonathan Linder earlier about this, is the cooperation with scientists and engineers and people like that was something we naturally had back in the 70s and 80s, and then it got all this conflict of interest. But it is I'm glad that you pushed it along, because it's a natural extension of the technology's capabilities.
Well, I think it's actually it's critical to our growth. I mean, it's innovation in science.
Yeah, absolutely. Judy, put on your futurist hat now and tell me where is this field going in the next 5 to 10 years?
Yeah, it's a very dynamic area. I mean, there are so many things that we're going to be going into. One is obviously the automation. Increasing automation and imaging is a natural fit for that, for machine learning. And I think we're going to need that because I think echo and its access is going to expand enormously because people are recognizing it's a wonderful technology and are going to demand it. And that's where machine learning will allow greater access. Actually, I think this is a very positive thing.
Yeah, I mean, it allows the novice who could be in those underserved areas to acquire certain
Absolutely.
images, and then you can take it from there.
Absolutely.
It's good. Other areas that you think are going to grow?
Well, I also think that there, in terms of physiology, I mean, we've kind of replaced the cath lab as as the physiologists. So there is so much we can explore in terms of cardiovascular physiology with some of the newer technologies coming. I see a lot of excitement in looking at tissue characterization with the aid of machine learning.
Right.
And so it's not just in sort of the workplace efficiency and providing greater access, but also in understanding physiology.
No, you're absolutely right. I mean, I think about things like strain, and even my favorite chamber is the left atrium. When it's big, mama's not happy. Something's not right when it's big. But I mean, you're right, those technological advances. Let me ask you 2 more general questions. We could talk for a long time because it's fascinating to me, but are there any noteworthy memories that you think back, and I'm talking really about events, people, and experiences, and you've had a lot of all of those. So what stands out as you think back about your time with ASE and your time with ECHO?
Yeah, there's so many wonderful memories, and I guess what I'm most grateful for, and it's memorable, I think about it a lot, is all the mentors that have helped me. And they've just been instrumental in my career, not only the MGH Echo Lab, but just sort of the broader ASE community. Again, I know this has been said many times, but ASE has been my professional home, and I am so grateful for all the friends and colleagues that I have met through ASE for my career.
Do you just off the top of your head, do you remember a particular case that stood out to you where ECHO made the difference?
Oh,
I know you got millions of them, but
I got millions of them. I could say, just I guess what burns your memory is your training. But I remember being an ECHO fellow, and being on call, coming in at 1 a.m. for the emergency room because a patient would just collapse and they didn't know what was going on other than there was pulmonary edema, and diagnosing a papillary muscle rupture.
Yeah.
But this is after like 4 or 5 hours in the ED, CT, chest X-ray,
you put the transducer on the chest and
and what was shocking is that a lot of people had actually put their stethoscope.
Oh, I know.
But it was the issue of the busy, noisy emergency room, tough body habitus. So
that's a great example. I remember an echo in the ER on a 19-year-old who was water skiing and had hit something and came in extremis, and they did the same thing. They did all this stuff, and it was a dissection.
Yep.
Deceleration injuries. But you're right. Let me ask you an interesting question. Donkeys.
Oh yeah, I could talk about donkeys forever.
So you're the
proud
owner of a donkey or donkeys?
Well, I actually can claim ownership to just one donkey, but Jenny has 2 or 3 other friends that she also is able to be with. But I feed carrots to all of them.
How did the fascination with donkeys come about? Not that it's not natural. I just don't know any. I don't know any cardiologists that have donkeys.
Some folks like have cat and dog therapy. It's for me it's equid therapy. So no, I actually go out to a country place, and there's a farmer next to me who is a beef cattle farmer, but also has a number of donkeys, and he lets me take care of them.
So you just like the animals.
I like the animals, and I help take care of them.
That's phenomenal.
It's a great way. You don't really have to be there every day, but
Donkeys are very interesting.
they're interesting and they're very therapeutic.
Maybe we need.
I think we should have-
We need more donkeys in society, running loose in society.
Definitely. Instead of the puppy area, we can have the donkey area.
You, Judy, you've done a fabulous job in your career. You were a great president, and I've enjoyed watching your educational pieces you've done. You've done some great things on aortic stenosis and other things, but you've been a credit to the society and to your field, and thanks for visiting with us.
Thank you, Randy. I can say that I try to emulate my speaking style after you, because it is not only educational, but I'm trying to be funny and entertaining as well.
The donkeys will help you a lot.
No, I just remember I loved your lectures.
Thank you.
And because I learned a lot, but they were also really funny.
Thank you. It's very kind. Thanks for visiting with us.
Thank you, Randy.